It's Tim and Becky from ChiroUp, and today we're going to show you a quick video on how to assess the number 2 peripheral neuropathy in the upper extremity, and that is cubital tunnel syndrome. Like all other peripheral neuropathies, it comes on because of either compression or stretch. So what are the things that do that and how do we assess it? That's what we'll talk about today. So cubital tunnel syndrome is irritation of the ulnar nerve at the funny bone here. And the quickest way to assess that is with the ulnar nerve tension test, simply making a circle with your finger, propping that up onto your face, and then flipping it into a monocle. If somebody then develops numbness and tingling into that 4th and 5th digit, there's probably a good chance that the ulnar nerve is irritated somewhere. So that's our number 1 test. Our differential diagnosis, it could be cubital tunnel at the elbow. There could be irritation at the wrist as the ulnar nerve comes through. We call that one Wartenberg's. Or it could be coming from a thoracic outlet syndrome, because remember, 90% of thoracic outlet syndrome present in an ulnar nerve distribution. So we can do our TOS test to figure out if that's the case. Then once we've identified the ulnar nerve as a problem, we identify the site of that process. Is it distal to the elbow or is it proximal? And we can do a nerve release by contacting the muscle and then stripping up that muscle as we extend the patient's wrist. And so we're breaking up any potential adhesions in the area. Or if it's above the elbow, we can do the same thing. We're flexing the elbow as we're extending the wrist, especially the 4th and the 5th digit, and stripping down through that nerve, so releasing that. And then the good news is sending that patient home with some home nerve flossing exercises makes a huge difference. The research tells us this is effective, and it's just like the test. We're going to move into that monocle position and then back out into a handshake. So from the monocle out into the handshake, back to the monocle and the handshake. And what the patient is doing there is they're flossing that nerve back and forth, because when a nerve is irritated, it's swollen. That swelling means there's increased hydrostatic pressure, the fluid gets pushed out, it starts to create spot welds, and that's where the traction comes in, and that's where the numbness and paresthesia come from. So I hope that you've enjoyed this information along the way, the assessments, the treatments, the exercises. I'm glad that Dr. Steele could give us a hand with this video.
Yeah, you covered everything. However, if you learn better just on the fly, check out ChiroUp. Everything he just talked about, plus everything he forgot, is in the condition reference section. Make sure to check out the clinical pearls. This is where Dr. Burlesman steals all of his information for every single blog from that one section.
Thanks for watching.